As part of our Delivering Prevention in an Ageing World programme, we've been consulting with experts from across the world to see how we can make sure we inspire and engage action on prevention. COVID has shown firsthand just how important investing in prevention is right across the life course, both as we build back from the pandemic, but also to make sure that our societies as a whole are more resilient, also in the context of an ageing society. So we've been holding a number of roundtable discussions, and we're also open for consultation at the moment. And we've been hearing lots and lots of things about good ideas and things that are happening. So if we look around inspiring and engaging action, one of the first groups of people that we think of are policymakers. So we asked the question of how can we inspire and engage policymakers? Through our last project, Prevention in an Ageing World, we spoke to lots of people from across the health sector, including really senior policymakers, who overall agreed. So how come action has been lagging? How come prevention is one of the first things that's cut in times of crisis and actually one of the last areas to receive investment? Well, for one, prevention is quite a hard thing to sell. So you're trying to sell an idea that you're trying to stop something from happening. So it's very hard to really visualize and make obvious what you've saved and what the benefit really is. Another issue is that lots of preventative interventions work on quite a long time horizon, and so some of the impacts might not be seen until 10, 20, 30 years down the line, whereas lots of political decision making is made on much shorter time horizons. So if people have tight budgets and are trying to legitimise spending decisions, spending it on prevention is potentially a bit harder and a harder sell. So we were thinking about how we can improve our messaging to policymakers to get the message across. So one thing that was mentioned is how important it is to really make an economic argument, because lots of these decisions are based on whether they make economic sense, especially if we're coming out of the pandemic, which has affected economies all around the world. Spend is going to be tight, so making sure that we're presenting prevention as something that pays for itself as an investment is really important. And COVID, I think, has shown really quite how interlinked health and the economy really are, and that actually we can't afford to fall behind on it. One other thing we spoke about is the use of big data that can help us potentially start visualizing some of these effects. So there have been lots of advancements in really showing on a population level, for example, how certain interventions have had effect or might have effect in the future. Another potential lever that we discussed is public demand, and I think COVID has created a real opportunity among all the devastation it's caused in real public awareness and a demand for public health and investment in that. And we spoke about the wider coalition. So if we want to influence policymakers, we don't just have to speak to them, we need the public on board, but we also need to make sure we're speaking to all the other relevant actors in this area, from the third sector, charities, and the private sector, and create a coalition of the willing. So we're not dividing separate asks by disease type, by risk group, because actually lots of the types of things we need and lots of the solutions are quite similar. So let's make sure we have a united voice and a united ask. And then finally, it was around measuring impact. So something like prevention that sometimes is intangible, where you don't have an immediate point of hitting a target, actually creating some of these moments and really storytelling. So from the really big level impact on a population level to individual stories, to bring it to life and show the efficacy. Next, we looked a little bit at how we can involve healthcare professionals. So clearly they're absolutely crucial, both in the actual delivery of preventative interventions, but also as advocates for prevention. And we know that lots of research points to the fact that people trust their healthcare professionals to give them the right recommendation, and they might base their decisions on whether, for example, their healthcare professional is vaccinated themselves. And so we wanted to look at how healthcare professionals can be supported to make the best recommendations and have the best impact on the people they see on a day-to-day basis. So what are some of the big barriers here? One that's become really clear in COVID is simply time. We know that historically in lots of places we've had staff shortages, and by its nature it's a very, very busy job. So if you have a really tight schedule, how are you going to make time to do prevention, so to speak? So a couple of suggestions that came in were around addressing staff shortages and making sure that we're actually making the most of other healthcare professionals, so from pharmacists to nurses, and using community settings to deliver some of this, either the actual interventions or the messaging, and then using data to make sure we're targeting those who need the most effectively. But for healthcare professionals to really work together, there are currently lots of barriers in the way. One really obvious one being that quite often they work in silos, they don't have access to the same data, so how are you going to make a correct recommendation if you don't have all the data? There's also a lack of incentive, so lots of systems are built around a sort of fee-for-service basis. So there isn't space, there is no remuneration often for doing the more sort of person-centered approach and thinking of a person as a whole, holistically, and thinking about health promotion rather than just treatment. Often there's a lack of clarity around responsibility. So often it's individuals themselves or their carers or advocates who are having to coordinate their care between lots of different healthcare settings. And so there's a big risk of people falling between the cracks. And there's a quote from one of our roundtable participants that said, if we could work together better, we could reach everyone. We just have to do it. And I should say, there's a lot of hope. We've seen during COVID people work brilliantly together. There's been lots of innovation, community leaders coming together and lots more cooperation across the health team and even more broadly. But clearly we need the right infrastructure in place that really creates the incentive, so we're not just relying on the goodwill of healthcare professionals to make this happen. The final area to focus on is of course individuals themselves, and none of this has any effect if we're not thinking about how individuals access health and can really be put in control to promote their own health and well-being. One big issue, of course, in all of this is essentially we want to affect behaviour change. So be that something as simple as encouraging someone to go to their vaccine or screening appointment, to longer term changes and lifestyle changes like eating more healthily. One thing that came across really strongly is that we need to make sure the message is right, so that we're not just talking about preventing illness, but actually about, how can you make sure you're maintaining your standard of living as you want, be as independent as you want, and keep doing what you love doing, whatever that might be. We need to think about the messenger as well. So while healthcare professionals often are a trusted source, they might not be for everyone, and actually we can't just rely on those people, because often we only circle into the health system when we have a treatment need. So how can we make sure those messages, are coming from everywhere, within our community, within our families, and all those different settings, and making sure that those messages and the messenger are relevant for each of the different, individuals who might be at risk, communities who might be at risk, and the wider community. We need to make sure that the right choices are easy, so we're not putting the responsibility on the individual only. If we're thinking, for example, about exercise, it's a lot easier to do that if you have a nice environment, whereas if you have no green spaces around you, that choice is made a lot harder for you. So we need to make sure that infrastructure, both in the healthcare system itself, but also the wider infrastructure, is there to make the right decisions. We of course need to tailor interventions, and we need to know who the message is directed at and target the messaging to those who are most affected. And then we ask the question, who else do we need to get on board? And I think the answer was pretty much everyone. We need to make sure the media is on side, that it's actually giving the right information and forming public opinion in a way that is conducive to prevention. We need to make sure people from the charity, the private sector, and the broader community are all talking the same language and speaking to each other and working together. And if we're looking at, the policymakers, then I think the answer is we need to look beyond health, because clearly health impacts on all sorts of areas and all sorts of government departments. So what next? There are clearly some challenges, and COVID has thrown up some more, but there's also some opportunities. So COVID has clearly highlighted and exacerbated issues around prevention and healthy living. There are lots of longer term repercussions, so lots of potential preventative interventions that have been missed out. Certain people will probably still be afraid of going to the doctor for some time to come. And there's been a huge impact on carers, on healthcare professionals, on people with dementia and so on. But there is a potential window of opportunity, and there is lots of public appetite and lots of awareness around prevention and making sure you're healthy. So let's make sure we tap into that. There's been also a lot of innovation. There's been wonderful work by volunteers all across the world, and let's make sure that we make the most of that, but also that it's formalised, so we're not just relying on people going the extra mile again and again, but that it's easy for national policymakers, local leaders, healthcare settings, and everyone involved to work together around a person's needs. So these are some initial conversations we've had so far as part of our project. Our consultation is still out. We're wanting to hear from people all across the world from different settings to hear, what we've missed, what are some of the other levers, what have we learnt, what works and also what doesn't, and what has COVID shown us. So do respond to our consultation, which is open until the end of May, and we look forward to hearing from you.